Today on Community Watch, I'm having a conversation with Dr. Gary Voccio, who is the Health Director for the Georgia Department of Public Health Northwest Health District. It's a long title, but we're talking about some vaccines that are out there. If you're like me, you need to know more about them. So stay tuned. Community Watch starts now. Welcome to Community Watch. Today on the show, one of our favorite guests, Dr. Gary Voccio, who is, I need a deep breath for this title, the Health Director for the Georgia Department of Public Health Northwest Health District.
Correct.
Is that the whole?
That's it.
The whole title.
Get the whole thing covered.
How are you doing?
We're well, thank you.
Good.
Doing well.
Good.
Hope you are.
I am good. I am, as I often am, confused about health-related issues.
Okay.
And you are going to guide me through
I'll
the
try
maze.
to clarify anything. I'll try. It is a maze.
All right. So the main thing right now is that we have some vaccines that are now available.
Yes.
One is the latest COVID option.
Mm-hmm.
So I'm a little confused about that, but there's some others too. So I want to kind of guide all of us, but myself too, through this. So catch us up on the COVID vaccine situation as it stands now.
Well, we have the COVID vaccine is now a monovalent vaccine. It is recommended for anyone 6 months or older. Unfortunately, we have a delay in getting them in our health departments, but they will be available very soon at our health departments, and they are probably available at our local pharmacies, private pharmacies. Be that as it may, it's a monovalent vaccine as opposed to what we had in the past, a bivalent vaccine. This monovalent vaccine, we certainly think is going to be able to attenuate and reduce hospitalizations, sickness, and death for the most part in most people who receive it. And it's a monovalent because if you look at the current viruses of concern, which is the XB1.5, the EG5, which are predominant in Georgia, those viruses are still the offspring on the Omicron variant, which everyone remembers, which is also an offspring of the original virus. Mm. So we are very, we see that the current vaccines backing up to the original one, the current monovalent vaccine, we certainly are very hopeful and think and pretty reassured by all of the virologists and the epidemiology experts that the current monovalent vaccine will be efficacious against the current strains of COVID.
Now, monovalent means you just take one.
It's one variant in that vaccine. It's the XB1.5 it's called, but it's that vaccine of that virus, and that virus is the progeny of all the other previous viruses. So we're pretty sure it's going to take care of almost most of the current COVID sickness and disease and transmissibility right now. You still can get COVID. Even with a vaccine, even with a prior infection, you can still get COVID. What the vaccines do is prevent you and reduce, not prevent you completely, but reduce the risk of severe disease, hospitalization, and death. You can still get COVID even with a vaccine. You can get most diseases even with a vaccine after you've been infected with that virus or whatever you may be infected with.
All right, so this vaccine is recommended for virtually everyone.
Virtually everyone, yes. Talk to your healthcare provider, but yes, we're recommending this for anyone over 6 months of age to get a COVID vaccine, monovalent vaccine. Like I said, unfortunately, we're having some logistic issues at our health departments. We don't have them yet at the health departments, but they'll be coming soon. We recommend that for most everyone to get a COVID vaccine.
And say for someone like my last booster was it's nearly a year ago.
Mm-hmm.
So
Mine
certainly for myself it would be smart.
Yes. Yeah.
What about for individuals who had a shot more recently?
They're still recommending this current vaccine. That's, you know, in effect, you're going to boost yourself. We do recommend the current monovalent vaccine, regardless of when you had recent, you know, the most recent, which was a bivalent vaccine. But yes, we're still recommending that.
Okay. And as far as we know, and I know things change frequently, moving forward will probably be a single shot every year.
It looks like that. Certainly, you know, it doesn't seem to be a seasonal thing. You know, COVID does not seem to follow like a true flu type of seasonal event, unfortunately. But if you look at the graphs that the CDC publishes, fortunately, it looks like each large peak that we have, those peaks are getting shorter and smaller. That's not to say we could have, you know, another variant of concern that is not, you know, the vaccines do not take control. But certainly it looks like those peaks and those durations are smaller. But the reason is vaccines work, and fortunately they work very well for the most part, and 96% of the population has had an exposure or been vaccinated. So that exposure to COVID and those vaccines really are reducing the peaks and the duration of these, you know, outbreaks that we have. So that's why we're still recommending people get their COVID vaccines.
And we are in an uptick of cases right now, aren't we? I mean,
we're seeing a slight uptick, but looking at the numbers recently, this seems to be trending downward. In Georgia, those numbers seem to have plateaued a little bit, thankfully. Unfortunately, in the past couple of weeks, we have had a few deaths locally and in other counties other than Floyd County. So it is still a deadly disease, primarily of the infirm, the elderly, people who are immunocompromised. So, you know, people need to still be mindful that COVID is out there. It can make you very sick and can cause hospitalizations and death, particularly if, like I said, you're infirm, elderly, undergoing some form of therapy that reduces your immune status. You've got to be very careful.
And I don't know that I've heard much lately about the issues that some people were experiencing at the long COVID, but is that still a concern? That's
still a concern. You know, we're still not sure what that is, but long COVID was thought to be 20% of the population who had gotten COVID. Now it's probably around 5%. And that's anywhere from chronic shortness of breath to fatigue, you know, mental fog. But the numbers certainly aren't as high as we initially thought. Most people, when recovering from COVID, considered to have long COVID. Most patients recover after a year. which is a long time. But when you're talking about a really severe acute illness like COVID, in my previous life I was a pulmonary critical care physician and took care of people post-hospitalization who had a simple pneumonia, who required intensive therapy. It took them a long time to recover. So these numbers don't surprise me at all from my past experience as a pulmonary critical care doctor.
And in order to get a test now for COVID, is there do we have any locations anymore, or is it all
yes,
home tests? Or how is it?
We still have our testing center at the fairgrounds. It's going to be moved for the festival over there to our health department temporarily at the end of the month. So be on the lookout for that. And some good news is we have also a kiosk at Gordon Advent Hospital for COVID testing, which is free. And another interesting part of the kiosk that we have there, very soon we're going to be implementing flu A/B testing in that kiosk also. So that's part of our armamentarium in getting people tested. But for the most part, like you were intimating there, John, is that most people are getting their home test done at home. Mm-hmm. You know, and that kind of skews the data, but it's a good thing. If you're sick with any kind of respiratory illness, fever, you know, chills, muscle aches, get a COVID test done, either at the kiosk at Advent Health, or at the fairgrounds, or self-test. Because there's treatment for COVID. People need to remember there are true treatments available. Paxlovid and I forgot, molnupiravir is the other treatment, which is Legavri. Those are the two oral treatments for COVID. They are very, very beneficial in keeping people out of the hospital and death. They've recently reports they're equal in treatment efficacy, and it reduces hospitalization and death in a recent JAMA study. So if you test positive for COVID, get that treatment within 5 days of your symptoms, particularly if you may succumb to it. Again, debilitated people, elderly patients, anybody with comorbid medical conditions should get treatment.
Now you mentioned flu, so that's going to be my next set of questions. It'll be about the flu vaccine. Now this is something we've had for quite a while. Mm-hmm. And the new flu vaccine is also available? Oh
yes, we have the flu vaccine at our health departments. They are available. It's a quadrivalent for the most part. For the most part, it is shown, at least in the southern hemisphere, to be very efficacious against the current flu. Absolutely. I'm going to get mine scheduled in the next couple of weeks.
Yeah. One of my questions, we're taping this at the very beginning of October, but one of my questions was about taking it and COVID at the same time or at different times.
No, you know, that's a good question. And what seems to be the best time to get it is simultaneously. It seems like in a recent scientific study that getting them together boosts your immune system than waiting. It's a very small study, but it was very intriguing in that the people who got them simultaneously had a higher immune response and a longer immune response than people who waited a few weeks from getting both. So you can get them at both times. Right. But if you're sick and you feel like you have flu, COVID, or RSV, if you really feel sick with any of those influenza-like illnesses, wait until you get a vaccine. Wait until your symptoms are better and you're feeling better, because you won't know if you're getting sicker with a flu or whatever, or it's caused by the vaccine. So you should wait if you're sick before you get a vaccine.
Okay. Well, we're coming up on our break, so we've got a lot more to cover. I have, we're working me through all of this. So stay with us. I think you'll learn a good bit. Don't go away.
Hope so.
Access to me means I get to explore and define myself.
Access? That allows me to follow my passion.
For me, it means I get to do what I've always dreamed of doing, helping people.
Access to me means I'm the first one in my family to come to college. Sé el primero.
Welcome back to Community Watch. I'm having a conversation with Dr. Gary Voccio, who is the Health Director for, and I have to read this, the Georgia Department of Public Health Northwest Health District, which is
Correct.
10 counties?
10 counties, yes.
Big.
725,000 people.
Goodness.
Yep.
It's a lot to keep track of.
Yes, and our nurses do a great job taking care of these our people in this health district.
Well, when we left for break, you had started talking about the flu vaccine.
Yeah.
And that it was probably a good idea to take it and the COVID vaccine at the same time.
Mm-hmm. Yes.
Now the flu vaccine it changes every year. I mean, based on what the current strain might be.
Correct.
of the flu.
Yep.
Is that vaccine accepted by a lot of people? I mean, do a lot of people take it? Is it?
No, unfortunately, the great majority of people who take it are in the older population. Most people age 60 or older will take the vaccine. Significant pediatric population will take it, but more or less in between, people don't take it. It's it's probably around 20 to 40%, but much higher in the older population and the younger population.
And yet, I mean, flu can be pretty devastating.
We've had in this country anywhere from 20,000 flu deaths at one time to a few years ago, 40,000 flu deaths. And I don't know if you remember, but quote, the Spanish flu in the early 1900s, millions of people died from the Spanish flu. It was not really from Spain, but the flu can be deadly. And in my personal experience, I took care of people in the ICU who sadly died of flu. People don't realize how deadly it can be. It's very transmissible, much like respiratory syncytial virus, just like COVID. They are very transmissible, highly contagious diseases, and flu can kill you.
And it is something, I don't know if the levels of COVID that are out there now justify, mask wearing to the degree that we did a year or two ago, but.
Well, that, boy, you opened a very controversial idea with that. You have to wear a good mask, and a good mask is a type of N95 mask. The surgical mask can be useful if you're really sneezing and producing large droplet nuclei, but the aerosolization of viruses goes through and gets around those loose surgical masks. They can attenuate for the most part and reduce aerosolized viral particles to a small degree, but the N95 masks are still superior than that mask, and there's no comparison to those, and just wearing like a cloth bandana, those aren't very useful at all. But if you're going to cough or sneeze, if you don't have a mask, cough into your elbow, cough into a handkerchief, at least to some degree you reduce aerosolization of viral particles. Those viral particles, whether it's COVID or flu, they spread for anywhere from 12 to 15 feet. They go a long way. be that as it may, wearing a mask, N95, is useful to a small degree, the other surgical mask, but very important is ventilation. You know, ridding the atmosphere of these aerosolized viral particles is very, very important. That's where the viral particles are, you know, washed out of the room or the environment where you are into the atmosphere, where there's less likely going to infect some other person. So
again, kind of a judgment call situation, I guess, with mask wearing. I know personally, the few times that I've been at an airport, I've you know, and been one of the very few people at the airport wearing a mask.
There are very few people wearing masks now. But you know, the ventilation in some of those places is extremely high for the most part. They will ventilate those large spaces to keep them cool, or, you know, control the environment, which is very beneficial. And then you get in a hot, stuffy train to get to the next the next terminal.
Yeah. Well, I definitely want to ask about RSV, which you know, I don't know how long it's been around, but it seems like this year is the first time I've been aware of hearing about it.
That's I was talking to somebody in our office today about that. That's a very good point you are making. Respiratory syncytial virus has been around. We've known about this virus for decades. It is a very contagious virus. It can last on hard surfaces anywhere from 4 to 6 hours. People acquire respiratory syncytial virus by someone sneezing or coughing in your face, or by touching a surface that has the virus on it and rubbing your eye or your mouth, and it's very contagious. In this country, hundreds of thousands of people are infected with respiratory syncytial virus every year. It is predominantly seen in the older population, and we lose anywhere from 6,000 to 10,000 older people. Older meaning ages past 60 every year in this country from RSV. And anywhere from 100 to 200 children every year from respiratory syncytial virus. The children in particular, the very young children, are very susceptible to this virus. The reason is, particularly in very young children, is because they haven't developed immunity to it or mature antibody response to it. That's why the new RSV vaccine, Abrysvo, has been recommended for pregnant women in the last trimester, because those maternal antibodies will pass to the baby and give them an antibody response against RSV. There is also a monoclonal antibody. Now, people are advertising this as a vaccine, John, but it is a monoclonal antibody. It's not a vaccine for children who have not had exposure to RSV, for children 8 months or younger, if they've not had any exposure to the RSV or not been in an RSV epidemic. So children under age 8 months are recommended to get the RSV vaccine. And up to age 19 months, if they are immunocompromised or have cystic fibrosis or any significant disease such as a childhood cancer, they should get an RSV vaccine up to age 19 months.
And the rest of us?
The rest of us, if you're over age 60 and have any significant medical conditions, diabetes, particularly heart disease, or any significant lung disease, you should consider, after talking to your healthcare provider, a RSV vaccine, either Abrysvo or Arexvia.
So the RSV vaccine is not a new thing.
Is not what?
A new thing. I mean,
yes, it's a relative. RSV, respiratory syncytial virus, has been around a long time. We never really tested for it, but now there's what's called PCR testing for it for adults, and in our labs they can test for RSV. But we really didn't test for it in the past because if it wasn't flu or recently COVID, we considered a viral etiology, but we had no treatment for it. We still don't have treatment for RSV for the most part, but that's why the vaccines are being made available, because of the significant disease it does cause in older individuals who have heart disease, lung disease, or immunocompromised.
So the RSV vaccine is an option if you fit into one of those categories.
Yes.
And it is a completely different virus from COVID.
It is totally different virus.
But it would have similar symptoms.
It does, and that's why it's so hard to differentiate just by symptoms. You're going to have fever, cough, severe runny nose, aches, the gamut of a typical viral infection, and that's why it's important to get tested, particularly because there's treatment for flu and there's treatment for COVID. RSV is different. There's really no treatment for RSV except symptomatic treatment.
Mm. All right, so would it be smart to take all three of those at once?
You know, yes, it would. Get them all three. Just get them over with and get all three. Because you're going, oh, I got another week or two here, and I got another shot to take. Yes,
yeah.
Get all three.
Yeah, yeah.
Get all three.
If only so you can remember it the one time. You don't have to.
By the way, we still don't have I want to make sure people understand, unfortunately, because of logistic problems, we don't have RSV or COVID vaccines at our health department. We do have flu vaccines available.
But that's likely to change very soon.
Yes, the folks at the state level are working very hard to get that remedied.
Yeah. So those are the three vaccines in a viral area where the symptoms are somewhat similar. But I was looking at a list of vaccines that are available for people. There are really quite a few. Mm-hmm. And one I wanted to ask you about, so it's a totally different area, of course, was the shingles vaccine.
Shingrix, yes.
Because that is something that can be extremely painful.
I had the Shingrix vaccine a few years ago, and it is a very uncomfortable vaccine. It's a 2-shot live attenuated intramuscular viral vaccine, and it is an uncomfortable vaccine to get, but there's nothing worse than having shingles. If you've known anyone with shingles, yeah. It can be extremely painful, extremely debilitating. So, the shot is, as I recall, a 6-month interval between the first and the second. But I think the discomfort from that shot is worth it because of the debilitating problems you can get with shingles. Most people have had, the shingle virus, been exposed to that virus at one time, the varicella virus at one time. Most people have had it, and it's, it sits dormant in your body. And at some point in time, it can reactivate, and it reactivates what's called against a nerve sheath. It harbors itself in your nerves. It can be in your eye, what's called skin dermatoma, the nerves around your body. It can be extremely debilitating. And
what age should you consider getting the?
As I recall, I think it's 60 or older, and maybe younger, but I think it's 60 or older.
Well, we're totally out of time.
Oh, it's just getting started.
Yeah, I know. But thank you so much. I have a much better idea of what's happening.
I hope so. I'll come back next week and we'll fix it.
We'll do more. Okay, thank you so much.
I enjoyed it.
And thank you for being with us this week on Community Watch. We'll see you next time.